You can start. Nurses, you can take over and start already.
Hello, good afternoon. Today we will have Staff Nurse Xue Li and Staff Nurse Hui Kun to share with you about today's topic, which is osteoporosis. So we will pass over the mic to Xue Li and Hui Kun. Thank you.
Okay, thank you. So good afternoon, everyone. Welcome to our health talk today. I'm Xue Li, and together with me, I have my colleague Hui Kun. We'll be presenting a topic of osteoporosis. So in between the session, we also have some Q&A. So feel free to participate. So today we'll be covering on what is osteoporosis, the incidence of osteoporosis in Singapore and in worldwide, who does it affect, what are the risk factors, and also some of the signs and symptoms. How do we diagnose osteoporosis? Lastly, the treatment and also the prevention tips. So what is osteoporosis? Actually, this is a disease that will affect our density and quality of our bone. So our bone will become more fragile and also porous. So porous actually means that our bone, the hole will become bigger. You can see my laser point here. So the right side of the bone as compared to the left side, right? The bone is actually, the hole inside is bigger and also wider. So when this happens, the bone will lose the minerals such as calcium more quickly than the body can replace them. So the bone will become less dense and also will lose the strength and break more easily. But most of the people do not realize that they have osteoporosis until they have a fracture happen. This is because that osteoporosis sign and symptom is not obvious. Hence, a lot of people call this as a silent disease. So these are some of the numbers happen in Singapore and also in worldwide. Around 200 million of people is affected by osteoporosis in worldwide, and also in Singapore, around the number also increased from 5-fold to about 400 cases per 100,000 million people in women. They actually suffer from hip fracture. Okay, so this is our first Q&A. Anyone know that who is actually more prone of having osteoporosis? Feel free to unmute yourself and you can, there's no right or wrong answer. So like you all can guess, usually the male or the female is more prone of having osteoporosis.
Women. Female.
Okay, I heard some of you say female is more prone.
Male.
Women.
Female didn't carry weight. Their bones not built strong.
Yeah, how about like usually is the younger or the elderly usually will have osteoporosis?
Elderly.
Elderly.
Okay, so actually all of you are right. We actually got two groups of people who are more prone to having osteoporosis. The first group of people are women who menopause before the age of 45. The another group are men and women over the age of 65. So these both group of people are at a higher risk of having osteoporosis. In addition, I heard some of you say women, right? Because they are more prone to having osteoporosis due to they actually lose up to 20% of their bone mass after menopause. So there are some statistics to be shared here. They actually say that we can see over the last 30 years in Singapore, the hip fracture increased in those age 50 and above, 1.5 times in men and also 5 times in the woman. So although women age 50 and above are at risk of osteoporosis, this can also affect the younger woman and also in the men. 1 in 3 women and 1 in 5 men over 50 will actually experience osteoporosis related fracture in their lifetime. So actually this fracture usually occur around the hip area, the spine, or actually the wrist. So why are women more prone? This is because osteoporosis most likely to occur in women after menopause due to the sudden decrease in estrogen. Estrogen is the hormones that help the woman to protect against osteoporosis. So these hormones, it has an important role in the growth of the bone and also help to protect our bone. So when women have menopause, the estrogen will decrease and then our bone mass will also be lost. Okay, now I will be sharing on some of the risk factors for osteoporosis. There are actually two groups of risk factors, one that can be modified and another group that cannot be changed because it's within us, such as genetic causes. So some of the risk factors that cannot be changed will be, example, age 50 and above, or being an Asian, because compared to the white woman, right, Asian women have found to be taking less calcium, as well as what I mentioned earlier on, early menopause before age 45, or you have a family history of osteoporosis. Usually family member will be like your immediate family member, your parents. So if they have experienced some osteoporosis related fracture, then you also might be at risk. Next will also be small bone structure or low bone mass or decreased bone density. Lastly will be history of a non-violent fracture. So this non-violent fracture example can be occur from a standing position. For example, if you twist an ankle or even a non-violent contact, such as you are hugging a child or you're picking up something from the floor, you bend down. If all these small action can cause fracture, then you might be at a higher risk of osteoporosis. So if you feel that you are at a higher risk, you may consult your doctor. And moving along, these are some of the risk factors that can be modified in your lifestyle. So this slide is important that you can take note of what can be changed in your daily routine. Example, if you drink alcohol, if you drink too much, this can actually cause your bone to be more brittle and can be break more easily. Or you smoke too much cigarette, this can cause your bone density to decrease as well. Or you're on certain medication, example, steroid. So this can also cause some bone loss. But I understand that some medical condition will actually require long-term steroid. So please do not stop taking your medication abruptly. If you're in doubt, you need to consult your doctor before stop taking any medication. Next will be inactive lifestyle. If you spend too much time sitting and you do not exercise, this will affect your body regulation and make your bone become weaker as well. Lastly, low calcium diet. All of us know that calcium can actually can strengthen our bone. So later my colleague will share how can we increase our calcium diet as well. Okay. So how do we diagnose osteoporosis? So these are some of the signs and symptoms. As we know that osteoporosis doesn't cause any specific pain or symptom. So we can actually take a look at all these signs and symptoms. For example, receding gum. These are the conditions in which your gum, the root surface of your teeth. Or if you have a decreased strength in your grip. Example, if you find that your strength is not as strong as before, or you have a weak and brittle nail, cramps and also muscle aches, or you have height loss. However, all these symptoms cannot be 100% sure that you have osteoporosis because all these are the common signs and symptoms for other diseases as well. So we strongly encourage that you consult your doctor. So after consulting your doctor, they will evaluate your medical history. They will check with you whether you have any family history of osteoporosis, and they will actually carry out some urine and also blood tests, as well as actually, most importantly, the doctor might do a bone mineral density scan. I'm not sure anyone of you heard of this scan before, but this scan is a measurement that can measure a person's bone mineral density. The measurement actually helps us to diagnose osteoporosis, and they can determine your risk for fracture and also assessment of response to the treatment. So if the doctor refers you to perform this scan, don't be worried because you'll be fine. This scan is not pain and is also very quick, only take about 15 to 30 minutes. And if you are going for this scan, there's no special preparation needed. You may eat and drink regularly, and even your medication you can take also because no need to fast. So osteoporosis doesn't have obvious symptoms. So we strongly encourage if the doctor schedule you for the BMD scan, you must go because you can detect your osteoporosis before any bone fracture. Then all of us can start to protect our bone as well. So now I'll pass to she will discuss about the treatment and also the prevention.
Okay, next, we will talk about treatment now. I will focus on treatment and preventions. So osteoporosis treatment will depend on your age, the stage of the disease, and your risk for fracture. Treatment usually available just to prevent further bone loss and improve bone strength.
Hello, do you have bone?
Usually we will
Okay, your
focus.
slide is on. Okay, now. Okay, good.
Oh, okay. So for treatment, right, we will focus on medication, exercise, and nutrition. All three things. These three things will be play a role in the treatments. Okay, next. Okay, next.
Your slides are lagging.
Yeah, sorry about that. I think there's some internet
Okay, you give
connection
us a while.
issues.
I will try to solve the issue.
Yes.
Mm, 我做在看
Okay, we try. I think now should be fine. Okay, so the treatment actually depends on different stage of osteoporosis. In the early stage, right, you may require only lifestyle change to manage the disease. And this lifestyle motivation will focus on nutrition and exercise to strengthen bones and prevent bone loss. So early stage of the osteoporosis usually will suggest to eat a healthy diet and getting enough of calcium and vitamin D. For exercise, right, will be weight-bearing exercise that can improve balance and posture, hence strengthen the bones. Okay.
Sorry,
If you
is the
diagnose with
slide
severe osteoporosis,
supposed to be on slide 15?
yeah, correct.
Slide 15. Oh, okay, can. Thank you.
Correct. Yeah. So I'm talking about the treatment now. So early stage of the treatment for osteoporosis will be lifestyle change and we'll be more focused on exercise. Okay. For lifetime change, right? Usually we focus on healthy diet, which is getting enough of calcium and vitamin D. Then and another one will be exercise. Usually we suggest to have weight-bearing exercise that can improve balance and posture, which hence strengthen the bones. Okay. If it's more severe osteoporosis you diagnose with, then the doctor might prescribe medication such as biphosphonate. These are the example of the medicine. And then if you have hormone deficiency also, doctor may recommend hormone replacement as a part of your osteoporosis treatment. However, currently osteoporosis cannot be cured, which is the medicine only can stop depletion of the bone marrow from the bones and stimulate bone formation. So prevention is still very important. Okay, next. Okay, do you think osteoporosis can be prevented?
Can. Is part of aging.
Okay, good. I heard some answer. Any more?
Can, based on our diet and exercise also.
Good. I think all of you have some basic understanding of the osteoporosis. Okay, next we will focus on prevention of osteoporosis. These are the 10 ways to protect your bones and prevent osteoporosis. I will go in detail one by one. Okay, number one will be eating enough of calcium and getting enough of vitamin D. So for age more than 18 years old, a daily intake of 1,000 milligram of calcium is recommended. So for those senior which is elder 65 years and above, should be eat at least 700 milligram of calcium a day. Okay, calcium is important for preventing bone loss. So a good source of calcium should include milk, cheese, certain green vegetables, and calcium fortified food such as juice or cereals and bread. Okay, roughly about 1 glass of milk will be 300 milligram, which is recommend one day you can take about 2 to 3 grams to get enough of calcium. So for our body to absorb calcium, vitamin D is required. Above 50 years old should aim between 400 to 800 unit of vitamin D daily. For food which is rich in vitamin B, such as salmon and eggs, these are the example lah. The next, sunlight actually is also a good source of vitamin D. So our daily, actually you can expose yourself in under the sun for 15 to 10 to 30 minutes, which should be sufficient enough for daily requirement of vitamin D. Okay. Next, we will talk about diet. So
65 years and above only 7,000 mg of calcium.
Madam Ho, okay,
Yeah.
so this is just a guide. So 65 years old and above should eat at least 700. Yeah. So I know some of you will have the supplement, and doctor maybe will prescribe the calcium for you also. So usually that one would be if you buy in the market, usually is labeled as 1,000 per tablet lah. Yeah. Okay. Next, we will talk about eating a healthy and balanced diet lah. So ensure that you have getting enough of phosphate and other minerals like magnesium, vitamin K, vitamin B6, and vitamin B12 is also essential for healthy bones. So bones are actually 50% of protein lah. So important to take sufficient protein also to maintain the bone mass density and skeletal metabolism lah. The recommend intake of protein every day actually is 2 to 3 serving a day. So one serving of meat, one piece of meat will be about a palm size for meat, fish, or poultry. Okay. Next, we will talk about number 3. We will limit your alcohol intake. Alcohol actually is thought to decrease bone formation and reduce the body ability to absorb calcium. So the recommendation for daily intake of alcohol actually is about 2 to 3 drinks a day only. Like a standard drink of the alcohol, like 1 can of regular beer is actually 1 standard drink. So one day maybe you take 2 can a day lah. Yeah, that's the recommend alcohol intake lah. Okay. Additionally, if you drink and then you get a little bit tipsy or you drunk, that all this will affect your balance and gait. Then it will increase the risk of fall and fracture also. Okay. Number 4 will be moderate your intake of caffeine. So for caffeine, right, it's best to keep to 2 to 3 cups of coffee or tea a day lah. Naturally, actually, coffee and tea caffeine can found in the coffee and tea. So excessively taking intake of the caffeine will increase bone loss lah. Actually, some of the soft drink also will have caffeine inside. So when you're drinking all these beverage, right, so need to bear in mind lah. Cannot take too much of the caffeine. Okay. Next, we will be focused on cutting down on salty food. Eating too much of sodium can inhibit absorption of calcium in our bone. Okay. Actually, Health Promotion Board actually recommend that adults should get no more than 2,000 milligram of sodium a day, which is equivalent a teaspoon of salt only lah. Yeah. Why is it we take so much of salty food or too much of calcium will affect our so much of sodium will affect our calcium, right? So when you take too much of sodium, which is salt, in the food, it will increase the calcium to pass out in our urine, which is so that result in the calcium loss in our bone. That's why we recommend you don't eat too much of salty food lah. Then usually salt can found in the processed food like some condiments, preserved vegetable, chips, and even some of the bread will have also lah. So when you buy all these things, need to check on the label of the salt lah, salt content lah. Okay, next will be the following tips will be focused on exercise. So just now we also got talked about weight bearing strengthening exercise in the previous slide. So we actually encourage you to engage in regular weight bearing exercise. This kind of exercise like dancing, jogging, weight machine, if don't worry, if you're unable to do all this high impact exercise, for low impact exercise will be like walking, aerobic, or exercise which is on those cross training and machine also can do. Okay, we suggest to do this exercise at least 3 times a week, but it's also important to avoid those exercise which is can injure your weakened bone lah, like your old injury or old fracture. Yeah, so for those elderly which is have not been exercised or have been suffering from some kind of medical problem, should consult the doctor first lah to do this kind of exercise. Okay, next, certain exercise actually can increase your balance and flexibility, such as like Tai Chi, Pilates, or yoga. All these exercise also can improve the balance lah. So, if which is will reduce the risk of fall. Okay. Next, we'll focus on the weight. Maintain a healthy weight is important for your bone also. If you have too light or your weight loss is too much, a low body weight increase the risk of osteoporosis. Hence, having a normal weight is beneficial for general health and reduce the risk of other chronic disease also lah. So a body mass index BMI, right, less than 21 is actually at least a risk of getting osteoporosis already. Okay, tips number 9.
Hello. Sorry, did you say below 21 is at risk?
Yeah, for the body mass index.
Oh.
Usually how we calculate the body mass index is the weight divided by height.
Height times height. Weight divided by
Two
height times height.
Two times.
Yeah, correct. Not sure you all calculate before or not.
Actually, no need to calculate nowadays. Polyclinic anywhere also have free. You go for your health check, you have.
Yeah, usually when you all go for health checkup, they will calculate for you all lah.
Yeah, thanks. Move on.
No problem. Okay, we move on. Tips number 9 will be smoking lah. Earlier, my colleague actually got mentioned it when in the risk factor slide. So smoking actually will increase bone loss by reducing the absorption of calcium in our body. We all know that actually smoking will affect our blood vessels and affect our bloods lah. Okay, so if you smoke too much, your body won't be able to absorb the calcium.
May I just add that actually there's a American research done that when we take calcium like milk, milk and meat must not be consumed at the same time because the absorption of calcium will not take place. Yeah, so you'll be wasting the calcium in the body.
Yes, they know lah. They're from hospital.
Hi.
And the day you learn already lah.
Hi, may I ask you also, huh? Hello? Hello? If we
yes, we can hear you.
If we take breakfast with coffee, then after that we take calcium, is it not good?
For sure, you wash away the calcium. Coffee.
So how?
Thank you for the questions. We will, Miss Christine, Madam Christina, we will take note of your question first. Why not we let the nurses go through, finish the
okay.
slides,
Sorry.
and then you all can keep your questions and write it down first, and then during the Q&A we will answer all of you shortly in a while. Okay. Thank you.
Thank you.
Hello, Hui Kun.
Yeah, we shall continue first. Yes. Okay, next will be start with smoking lah. So I think you all heard me about smoking part. So we have one more tips will be about the height lah. If you lost your height more than 6 cm or more, there's a chance of actually you might have osteoporosis lah. So when you certain or over the years you are losing too much, to expect to see a doctor. Sorry, I think our internet was not stable lah. Earlier, y'all can hear me.
No, I think I can go through the last slides with them again.
Okay, you hold on.
The last
I
slide
go
was
back
the
to the
height
last
lah.
slide.
Yeah. For the height,
Done already.
osteoporosis lah. So we suggest you all to the done already. Okay.
Your losing 6 cm is within how long?
Hello, Shirley or Hui Kun, are y'all with us or the internet connection is still down from your end?
Sorry, our side is still a bit lag. What's the question just now?
Saying that losing 6 cm is within how long?
Losing of 6 cm is not like immediate. If gradually, like between a few years, if you feel you measure your height like it's like getting shorter and shorter, then this might be. But you, of course, you need to go and do a checkup. The height of the loss of the height, right, is not a accurate answer for the definite to osteoporosis diagnosis. So we still need to go and take some blood tests to see whether your hormones, is it enough? And then also do the BMD test to see whether osteoporosis, is it there or not for the diagnosis.
Thank you. So I think it's a gradual process. We have a couple of questions on the...
Sorry, can I ask you, you mean that the hormone will affect our height also? In what way and how is it?
The hormone is the estrogen that actually will affect our bone. So if the estrogen is actually help to protect our bone and also making it more dense and also more hard. So if we lose our estrogen, right, our bone will become more soft. So when our bone become more soft, then it will actually compress to each other. And then this is why our height will also be lost as well.
I see. That means those with thyroid with hormone problem will be in danger.
Usually it's like the hormones that we are talking about usually is like our estrogen, the one that we for women will be estrogen. When they have menopause, then it will also be decreased.
Yeah. So then I think those with thyroid, they need to eat more fish. It can't release all those calcium items. Can I know what are the calcium items in that case? Can you guide us?
Calcium item, for example, milk, cheese, tofu, cheese, all these the dairy product actually help in calcium.
Yeah, that one I know.
And also sardine.
Sardine also. Okay, I've been eating saba fish and tuna every now and then, and fish soup. Because I got thyroid problem. Hypo.
Okay, so if you are worried, you can actually do a checkup with the doctor, tell the doctor your concern, then they can do a screening for you. It will be more accurate.
The doctor said, no need, you're so good already. He keeps telling me. No need to take supplement.
Okay.
Because I have been drinking. Oh, yeah, the another thing is the milk. Can we just one time straight away drink 2 glasses of milk? My husband likes to drink like that. Almost 1 box, 1 time, going to finish all 1 liter. I told him no good, you don't absorb, you must split into 3 times to drink 1 glass like that. Is that right?
If he can take it, he can actually drink. It's not so much about like whether the body can absorb or not. But if you take too much, it also depends on whether you got other health condition, like whether your body can take too much calcium also or not. Yeah. So if we don't recommend like one day you finish 1 whole bottle of the milk, it will be too much also.
Yeah. Okay. And then the body won't be absorbing 1 time so much, right?
If the body absorbs too much calcium, right, then you might have other conditions also.
Yeah, stone around. Okay,
yes.
Thank you. Pass.
I think we have earlier on, Madam Christina actually checked about her questions regarding. Madam Christina, are you still there? Yes.
Yes, thank you. May I ask first question? The first question first. Actually, I have osteoporosis and on medication. Is it that I have to take the medicine for my remaining life?
Doctor prescribed the medicine. I believe it's calcium supplement. So maybe you are not taking enough from the food. Yeah, or maybe your body unable to absorb. So doctor prescribed the medicine for you. Yeah. So I think as long as your calcium level is low, doctor will still recommend you to continue to take your medicine.
Oh,
so that you have enough of the calcium.
The medicine is dendromite. Hello. Now I'm taking the medicine. I think pronounced as dendromite. Once a week. Because I heard the doctor told me maybe you carry on for 2 or 3 years. Then like no need. Is it so?
Doctor will still need to take your blood to check your level, so that can give you a proper examination. Yeah.
Okay.
I can't give you a definite answer now. Yeah, because the doctor will still need to check the blood level and all that. Yeah.
Okay. Earlier I asked a question because I always take a cup of coffee for my breakfast. And after that I take calcium. I have this doubt. Is it that I have to wait for like some time then take the calcium, or don't take the coffee, take the calcium after 1 or 2 hours, then take coffee?
Understood lah. Cut down your coffee lah. Change to milk.
Calcium and the coffee, it will have direct effect lah. So as even though you take the coffee immediately, then you take your calcium, it shouldn't be affect the absorption of the calcium.
You can't be too sure, because
But what
caffeine.
What happened if the
it's better
coffee
to-
there's milk?
Yeah. Okay. Earlier, I think share when you take too much of caffeine, right, which is take more than 800 milligram a day, then it will affect the absorption of the calcium. Yeah. So if you only take 1 cup in the morning, it shouldn't affect so much.
But what happened if the coffee there's milk?
Yeah, which is correct. And sometimes you will add milk in the coffee. So like what I say, if you drink 1 cup a day, it shouldn't have a problem. So recommend we would.
But not true, doctor says don't. When I collect my medicine, they say that don't mix calcium with milk. If you drink milk, you don't take calcium. You have to wait a while. Am I right?
Yes, and don't take your coffee with your medicine.
So just follow the doctor's direction.
The nurses are not updated.
Then how about
not only one medicine? Some other medicine will also affect this lah. So I'm not sure what medicine you are taking also, because other medicine it cannot milk and coffee and all that. I see in the group chat a lot of people asking how to go for the checkup lah. So we recommend to go to polyclinic to have a proper clinical examination done by the doctor. Then the doctor will see if you need the bone mineral test, density test or not. Yeah, that one we need to doctor to order and prescribe lah. So usually it's done by after the doctor consult you lah.
May I just check, nurse? Hui Kun, right? Is that bone density test done, the blood test done at the polyclinic, or must they go to the main hospital, and also the hormone test?
For the blood test, right, you can actually go through the polyclinic. So if the doctor feel that you need to do the BMD test, this test will only be doing in the hospital, because this is quite a big machine. So if they think that you need to, then they will schedule you for this BMD test. But for the basic blood test, they'll be able to take in the polyclinic.
Basic blood test meaning
they will be able to check your blood and also your urine. So from the blood,
Bone
usually they will
density
check your,
test will be done at the main hospital, you mean?
yes, the BMD test will be done in the hospital.
And also the what is called it? Hormone density.
There's no hormone density. Hormone, right? My colleague was saying that because hormone can affect your bone protection and also formation of your bones. So the hormones, they actually will just take a blood test to see whether that you have enough sufficient hormones in your body or not. Then from there, they will actually give a correct treatment, see whether if you need any replacement.
Great. So do I assume this is done at the polyclinic?
For the blood test, you might do in the polyclinic, but
Hormone
this
blood
also
test,
provided that the test, right, is also provided that the doctor feel that you need to do so before they will perform for you.
Sorry, can I say my question again?
Yep.
Is the hormone test available at polyclinic?
No.
They should be able to check your hormones in the polyclinic.
Yes.
It's part of the blood test.
Or parts of the blood test. Okay. So that's it.
For
Whether qualify, don't qualify, that is another matter. My question is whether that's available in the polyclinic. Okay, thank you. That means yes, your answer is yes.
But according to her, the blood test that they can test as well as the hormone. There's no hormone test at all. You only through the blood that they will check on your hormones, if I'm not wrong.
Yeah, so the hormones will be the blood test, lor.
Thank you. So I guess the nurse is trying to say that if you want to check via polyclinic, the only way to get your hormones checked is through the blood test in the polyclinic. Okay.
Yes, thank you. Got you.
No problem. I think we have another few more, 2 to 3 more questions on the group, in the chat box. So, Madam Lim is actually asking how much is 700 mg of calcium to be taken in daily or food intake? Will 2 portion of green vegetables and fruits be enough? And with enough sunlight as well. So I guess she has 2 questions. So one is how, yeah.
The 1 glass of milk, right, is about 320 mils. For 1 glass of milk is equal to 300 milligrams lah. So this is how you gauge the calcium you can absorb in your body. So we recommend if you drink milk as a calcium source, right, then take 2 to 3 glass a day will do. Yeah. Then for the sunlight, right, usually we recommend 15 to 30 minutes under the sunlight should be sufficient lah.
Okay, so on top of that, if you would like to take vegetables, right, try to have dark green leafy vegetables. Actually a good source of calcium, just as like your spinach or even your kailan as well. Actually a good source of calcium.
Yeah, correct. For sure, this I think I didn't mention just now. For the vegetable, actually for calcium, right, like broccoli, pak choy also have quite good amount of the calcium level lah.
Yes. Okay. Thank you. Then moving on, I guess the BMD you have actually gone through with it. Then Madam Serene said that getting fat now can't join the exercise now. If put on weight, need to go for a checkup. And she's actually 62 years old, has never done a checkup before. So how will you advise her to actually go for a checkup, or what checkup should she be going for?
For Serene, I think I'm not sure if she is under our resident also. If you are not under our resident, you can actually book appointment with your nurse to talk more about your condition, because I'm not sure how is your weight now.
So it's very hard for our nurses to determine as of now.
Correct. If I want me to give some opinion, if you really think you require a checkup, it's good that you book appointment with the polyclinic lah to have a proper checkup with the doctor. You think you are at risk lah. Yeah.
Okay, so it's still best to go for a checkup to see a doctor, like what Hikun has shared, so that they can give you a further advice on which checkup you should be going for. Then I have one question. If they do not go for a checkup, right, and they actually have osteoporosis, in the long term, what will actually happen to them? I think there's one slide that you actually mentioned earlier on.
I think earlier, my colleague Shirley has shared about the non-violent fracture. So if you have, because you have never diagnosed before, and then it happened, then you have severe osteoporosis, and this minor force which apply on your body, right, it will affect the bone, and you'll easily get fracture. Yeah. So it happened to a lot of elderly is the back pain. Yeah. So when your spine bone is become porous and have the severe osteoporosis, right? Yeah, it's easy to get a compressed fracture over your spine. So that's why sometimes people have the backache, but they're not sure what's happening. Yeah. So all this usually require tests and scan to identify that.
The reason why she's asking is because her mom is actually in nursing home right now, so unable to bring her for further checkup. I guess for that, you can actually check in with the nursing home nurses to actually let them know your concerns, and perhaps they can actually arrange something from the doctors there to assist you with that inquiry of yours. Yeah. Okay. Any more questions coming in?
Yes. May I ask you? I heard that people has osteoporosis, the life will be shortened. Is this so?
You mean if you have osteoporosis, your life will be shortened? Am I correct? The question, I guess, it's not because of osteoporosis, because of the complication of the osteoporosis, which is it will easily get fracture. Yeah. So once you fall a simple fall down, like trip and fall, you might fracture your hand or your leg or your hips. Yeah. So it's the complication after that you might affect your life lah. Yeah.
Thank you very much for your
answers.
Nurse, I want to ask you this question. The milk, what type of milk product is good? What brand of milk? It's low-fat milk.
I think you can take those low-fat high calcium milk. Whichever brand I think is all right. As long as you can see they have a healthy logo there also. So you can choose those low-fat and high calcium milk.
That madam, if you can afford, just go for organic milk.
They're all the same.
Yeah. Any last questions?
And then milk.
I guess there's a lot of milk. There's a lot of brands of products on milk in the market itself. As long as what staff nurse Shirley has mentioned, if you check on the label itself, it has these higher in calcium content. And with its low fat, it's in low fat, then you can actually go and purchase the product. But if you have a specific brand you would like to go to, and you have been drinking for a long time, I think it's fine as well, as long as it's all beneficial for our bones. Yep.
What about those who cannot tolerate milk? Then can they drink soya milk instead? Or any milk that
you're right.
is lactose
You can
free?
actually drink
what
soya
kind
milk.
in the market? I find it difficult.
So for the product itself, right,
Is there any type like lactose free milk? I don't seem to.
In that case, if you are looking at this in the market currently, there's a lot of lactose-free milk itself. However, if it's lactose-free, then it will not have calcium content. So you have to look for this word called calcium fortified. So it meaning that they have added the extra calcium in the beverage itself. So like soy milk itself has high in calcium, or other beverage drink you are looking at that is added this calcium fortified food. Or otherwise, like staff nurse Hui has shared, there's a lot of other food products that contains high in calcium food high in calcium, like your sardines, your ikan bilis, your broccoli, your bak choy, and other food that has high in calcium as well as a substitute. Tofu itself also rich in tau kwa itself, rich in calcium as well.
Okay, thank you.
And yeah, some people cannot tolerate it because of the uric acid.
Sorry, we couldn't catch you. Do you mind sharing your questions again?
Yeah, because you're talking about soy product. The soy product is high in uric acid. So some people might not be able to tolerate it.
Yes,
if they have
the food products that we are sharing is on a general advice itself. So if you have your specific health condition, then I'm sure the dietitian will actually, or doctor itself will actually recommend the food that you should be avoiding as well. So if you have uric acid, like you have these participants have shared, yeah, then you can avoid certain food product and substitute with other higher calcium products.
Because there is also almond milk instead of soy milk.
Yes. Oh, thank you for the sharing. Any last questions for our nurses?
护士，请问一下哈，如果他是乳糖不耐症，不可以喝牛奶，那么他又痛风，但是也不可以喝豆奶，那怎么办呢？
刚才其实他们有讲很多食物啦，有钙质的啊，还是你是要听华语的是吗？
不要紧，你讲，你方便你讲。
刚才其实他们有讲了很多，像有些蔬菜呀，它们里面也会是有那个钙质的哦。好像刚才有另外一个
像野菜花是吗？
的，他们有说，其实你可以不用喝牛奶，你可以喝那个 almond milk，almond milk 是
杏
仁的牛奶啊，而且有些对，像这些，只是你买的时候啊，你需要看它那个 label， 你买的时候你要看，他们会有写高钙的。
好，那除了杏奶，因为你不可能整天喝杏奶的庙，还有什么庙啊？
有些果汁里面也是会有，所以你要注意咯，你买的时候
看它的calcium 哈有多少分量。
对，看对。
好，因为刚才我很吵，我听不到这一段，不好意思，再重复问你们，谢谢啊。
好，其实如果你要听这个华语的话，下2个星期是华语的，下个星期我们没有，是因为国庆了，然后再下一个星期16号是华语的你可以再参与多一次。
可以，好的。
Thank you, Shirley and Hui Kun for sharing. So, for those who actually wish, sorry.
Can you answer my question in the chats?
Okay. Oh, okay. Sorry. We missed out your question. So, you were saying that you put 3 tablespoons of omega plus milk powder into the cup of coffee.
Yes.
Is that okay? As I hate the smell of milk. Hui Kun or Shirley, do you want to assist Madam Lee on this question? She said that she disliked the smell of milk, so she actually put in the milk powder inside the coffee itself. Will that be fine?
Yeah, from our point of view, we feel that actually it's okay because it will still be able to absorb into your body, the calcium level.
Thank you.
Yeah. Just that, just now you were saying that the coffee, the caffeine will actually inhibit our body from taking the calcium level. But as long as we take everything at a moderate amount, right, it should be fine.
Okay.
Okay. Any last questions? If not, otherwise, thank you all for
Hello. If you don't mind, Hello, if you don't mind, may I ask you, is it there's something called vitamin D3, right? And it's better than vitamin D?
Yes, vitamin B3 actually can be found in your other food product as well. So vitamin B3 are actually actually all foods and vitamins complements one another. So it is still important to actually get your vitamin B3 intake as well. But there's no such thing as vitamin B3 is better than vitamin D or vitamin A or E. It's all equally important for your body, and it helps in different ways for your body itself.
Yeah, because first I heard that vitamin D3 can against COVID-19. Recently, not long before I heard it. So first time I heard about that, about vitamin D3.
Okay, interesting sharing, Madam Christina.
Yes, I heard it in the YouTube.
Yeah, thank you for sharing. But all vitamin is actually good for the body.
Yes.
Yeah, so one type of food, right, can actually have a few vitamins in a food, which is good that if everything we take, we have a well-balanced diet.
Okay. May I tell you, I'm so sorry. Just now I was engaged with something, so I was quite late now. So sorry. I feel
It's
guilty.
okay, don't worry.
Yeah.
Thank you. Thank
yeah,
you.
me too. Would you, when everybody leaves, can you just stay behind just to take slide 1 to 9?
The session is recorded in the Riding Mass Constituency Facebook. Once the session ends, you can go back there to check.
Okay. Okay. All right then. Thank you.
Okay, actually we will actually leave the Radima's Facebook link in the chat box itself, so for you to find it easier as well. So thank you all for your participation today, and even some of you have managed to share some of the knowledge with the rest of us as well. Yeah, so for our next outcome,
我可以问最后2个问题吗？ Hello?
Yes, you may.
请问那个
but
calcium 的药有没有说 liquid 的不要 tablet 的，因为我吃 tablet 不可以 absorb 的。有没有 liquid 的？
For liquid 的，在 hospital 我没有看过吧 你可以在那些药房看一下，因为药房也是有药剂师，
我问过了，
你可以问他们有没有。
没有，他们说没有。
因为我也是没有看过有 liquid 的。
好，还有一种药 NEU 维他命 B 来的，这个长期吃会有没有什么不好吗？
副作用。
对
，NEU
维他命 B1、B6、B12 这些啦。
全部的 vitamin 我们吃了都会对我们的身体对我们的身体每一个部分都会有不同的作用，都 OK， 只要不要过用服用它的 dosage 的话，就很像如果那个药瓶上说1天吃2粒，如果你吃4粒的话，就会 over dosage， 对你的 body 也是不好。
因为我的指甲一直裂，所以医生叫我吃这个。那我头发一直这样，他说你要吃维他命，就是介绍我吃了。因为我吃很多个月了，这样我怕，我就是请教你是长期吃，如果没问题，我就是继续吃下去哦。
对，如果你吃了你觉得没有副作用的话，你是可以长期吃下去。可是你长期吃下去的话，你也是要看对你的身体有没有那个 benefit。如果 OK 的话，你可以继续吃。如果你觉得对你身体没有 improvement 的话，你就可以跟医生说，你觉得你吃了没有用，可不可以换一种其他新的药？
好，可以，谢谢。
还有一个问题，我想问最后一个问题那个 calcium 请问那个 calcium take from government one and buy from outside one, any difference? Calcium.
From government, you mean in the government hospital?
Clinic or hospital they give one, and outside buy one, any different?
I think some calcium tablet is just contain calcium, but some of the calcium supplement you buy from outside, right? They actually mix together with other vitamins. So when you buy, right, you can take a look at the information there. They actually will write whether it contain of only just calcium or other vitamin also.
Okay. So how do we know whether it is outside one suitable for us or not? Who should we see?
They also have pharmacists at the, like example, Watson or Guardian. They also have pharmacists there. You can ask them.
Okay. Okay. But then if let's say the doctor say take, let's say say take 2, I take 1. Okay, effective or not effective?
If the doctor say take 2 dosage, I mean like because every tablet got different dosage. If the one that the doctor prescribe you, they say take 2, that means that the 2 tablet will be sufficient for you to have the daily consumption of calcium per day. But if you take 1 only, means that it's not enough.
Oh, okay, good. Thanks. Yeah. Okay. Thank you.
Okay, welcome.
Okay, I guess wherever you are purchasing from, as long as it's an authorized seller itself, not try not to buy from like some friends say, oh, this high in calcium that you should buy, then we will not recommend you like if you're buying from outside. Just like what Shirley has mentioned, can get to the pharmacies at either Watson's, Guardians, or any other places which they have someone to actually share more information with you, and you know that the product is actually safe for your own body consumption. It's most important.
Okay, thanks. Actually, what's the best time to take calcium? I'm sorry. What's the best time to take calcium? Especially you have some other medication to take.
If you're afraid it will affect other medicine, right? Actually 2 hours apart, or sometimes really afraid it will have some interaction, right? 4 hours apart is a good enough lah. Yeah.
4 hours apart. Okay, thanks. How about, sorry, last one. How about I take before I sleep? I take before I sleep. Is it better? They have to sleep well, is it calcium?
Sorry, can you repeat your question again?
I would like to take before I go for bed. I mean, before I sleep at night time. Is it better? It will help to sleep also, is it? It help me to sleep.
Calcium doesn't help you to promote your sleep better. Yeah, they don't have the benefit of sleeping.
Okay.
But I think you should take calcium in the morning because you need sunlight. After you take Lori, you should go for a walk.
But then I have other medications. They say cannot take.
Yeah, at night where got sunlight there.
Yeah, okay, thanks. Thank you.
Okay, thank you. Gary from Adimas already shared the Facebook link on the chat box already. So for those who missed out the first part of our sharing, you may actually head over to Radima's Facebook to catch up. Otherwise, for those who wish to attend our Chinese version of this osteoporosis health talk, it will actually be on 16 August, not 9th of August as it is our national day. If not, for our next English health talk will be on the 23rd of August, 2 p.m. as well. Okay, so for those who stay near Radimas and you have any health condition inquiries and you want to seek help from our community nurses, feel free to drop by Radimas CC community nurse post on every Friday, 9 a.m. to 4 p.m. So we can actually get our nurses to assist you, but then due to this current COVID situation, we do not take in walk-in. So if there's anything, you can actually drop us a call, or maybe you can, if you're nearby Radima CC, perhaps the Radima CC staff will be able to assist you to help us to take down your appointment slot first. Okay?
Thank you.
Meanwhile, stay safe and happy National Day to all of you. And we shall see you in a few weeks' time. Bye.